Earlier, we talked about the morbidly obese moving to the top of the priority list for the swine flu vaccine. Joining us is Dr. Yvette David. We call her Dr. Y. Hi, Yvette. How are you tonight?
Good. How are you, Fred?
Good, thank you. Some may say that is not fair. From a medical perspective, do you think it makes sense?
I absolutely do think it makes sense. Now that we've had a couple months with the disease and we've seen in California over about 1,000 hospitalizations, 50% of those hospitalizations were in the obese and 25% in the morbidly obese. And you see morbidly obese take up about 5% of the population, so you're seeing a 5-fold increase in the morbidly obese. So we're talking about complications of the virus, not the virus itself. And morbidly obese have higher risk of complications.
Okay, I want to get to this before we go here. We've talked a lot about medicinal marijuana over the past couple of weeks, and lots of cities are trying to ban dispensaries. But the AMA came out today saying the federal government should look into reclassifying the drug, essentially saying there could be positive effects from medical marijuana. Are you surprised by that?
No, I think we've always known something. There's a subset of patients that do better on medical marijuana or, marijuana that they're taking on their own when other drugs for nausea or for malnutrition or glaucoma are failing them. What the AMA is saying is they're saying that at class 1, you're putting it in the category of LSD and heroin. You can't do clinical tests to try to figure out where if and where it will have benefits. And also there's a big deal about should it be smoked or should we have a better delivery system? And that's where we need the clinical studies to figure out would putting it on the skin or underneath the tongue be a better, stronger, safer delivery system that's more even throughout every patient that's taking it.
So what you're suggesting here is that there may be some medical benefit to actually using it.
Absolutely. There are some people that say that with malnutrition, with nausea, that is the best thing for them. When other drugs, luckily we do have many drugs for these conditions that do work for most people. But just like blood pressure or other chronic diseases, some people do better with one prescription over another. And what the AMA is saying, let's not close our doors to it. Let's look into it and see if there's a way that we can do this in a safe way that will benefit the most people.
All right. Yvette, well done. Nice job tonight.
Thank you. Nice talking to you.
Okay.